Well, my friends, there are various nerve disorders or diseases related to central nervous system. This is a disease, a very rare genetic pathogenic disease which is known as myotonic dystrophy. Myotonic dystrophy. In modern medicine, as this is a genetic disorder, there is no relative treatment. The parents went to Christian Medical College at Vellore, diagnosed myotonic dystrophy type 1 without any good result. As this is a genetic disorder, they have nothing to do. So in genetic disorders and in the family history, the mother and other persons also suffered from myotonic dystrophy. The main dysfunction of the disease is action of the nerves becomes less and lesser. That causes progressive muscular weakness. তাহলে মাসেলের যত রকম কাজ হয়, চিবিয়ে খাওয়া, হাঁটা, বসা, লার্নিং এবিলিটি, all becomes disabled. Cognitive development also will be disturbed. Impaired. Because the total nervous system, the brain and spinal cord becomes non-active, inactive. This is called myotonic dystrophy. It can occur at any age, but mainly in the children. A gene mutation on chromosomes number 19, is the cause or responsible or the villain for this myotonic dystrophy type 1. There are two types. Number one, myotonic dystrophy type 1, and there are also myotonic dystrophy type 2. In myotonic dystrophy type 2, is caused by the gene change in a different pattern, which is found in chromosome number 3. You should know this. And that's why the physiology, practice of medicine and pathology is very, very essential to study for every physician. So, for type 2 myotonic dystrophy, the gene changes in the chromosome number 3. How you will confirm the diagnosis? A blood test will usually confirm a diagnosis. Myotonic dystrophy. Understand? So, myotonic dystrophy. Now, as it is a serious and genetic disease, the question arises how long a person lives with myotonic dystrophy. It depends on the type and severity of the condition. If a person has mild myotonic dystrophy, a person has lesser degree of myotonic dystrophy, number one, the condition may not affect their life expectancy. But the type 2 are very dangerous and causes serious and severe degradation of the nerves. Myotonic dystrophy is also known as dystrophia myotonica. It is also known as dystrophia myotonica or myotonia atrophica. So, in short, it is a muscular dystrophy, a type of muscular dystrophy due to genetic disorder that causes progressive muscle weakness and loss of muscle power and muscle stability. Now, what will be the homeopathic treatment? As it is a genetic disease and modern medicine demands they have no treatment, they have no medications. What we may do? What will be our procedure? We treat the patient, not the disease. So, no question of any kinds of disease, whether gene-related or genetic, etc., we may try by treating the constitution of the patient. As our medicines, it has been experienced, it has been proved, it has been exercised that our medicine can also alter the gene, change the gene. The dynamic medicine has the capacity or capability to alter the gene very slowly and can modify the genetic disorders. Now, what is the symptom similarity is the main point of view. Causticum is one of the important medicine which acts over the brain and nervous system, central nervous system, and this patient is chilly with fear of dogs. Fear of dogs. কুকুরের ভয়টা বেশি, এটা আপনি লক্ষ্য করে দেখেছেন. So the guardian has claimed there is fear of dogs, and fear of dogs is the rubric also covered by Causticum, Belladonna, Causticum, China, Hyosamus, and Tuberculinum. So considering the pathology of the disease, considering the fear of dogs, considering the chilly patient, and memory weak, cognitive power lack, my first prescription is Causticum in 50 millisiemens scale of potencies. Let's try how much improve we may expect from this medicine which will fall upon this little child.